Cocaine and its effects on prenatal development. Cocaine is a very popular and highly addictive drug. Its purity is always a concern as it can be cut with other potentially harmful to ingest substances, such as talcum powder or other stimulants like amphetamine. These other harmful substances uh, can add to the negative effect on the developing fetus. Cocaine works as a central nervous system stimulant and has been termed a teratogen due to the causes of defects in fetuses during prenatal development. Cocaine use during pregnancy can cause some health risks for the mother to be. Some of the health risks are anemia, which is a condition where red blood cells are not appropriately produced, seizures, preeclampsia, which is sudden and dangerous rise in blood pressure, a higher risk for C-section, constricted blood vessels, increased heart rate, and increased risk of arrhythmia, as well as placental abruption, which occurs when the placenta detaches from the uterus prematurely, reducing the amount of oxygen and nutrients available to the fetus, which can cause fetal death. And it can also cause heavy bleeding in the mother. Less than 1% of births in the United States suffer this. However, the use of cocaine increases the risk to 10 to 19%. Ways that cocaine can enter into the embryo and fetus is through crossing the placenta and entering into the embryo and fetus bloodstream, diffusion into the umbilical cord, as well as in the amniotic fluid, most likely as a result of fetal urination. Prenatal cocaine exposure can have several severe physical and neurological risks on the embryo and fetus, such as premature birth, which is when a baby is born before 37 weeks. Premature birth may cause cognitive issues and problems with the heart, eyes, and other organs. Premature babies have a lower survival rate, and those that survive tend to have more long-term problems, such as cerebral palsy, autism, vision problems, and intellectual disabilities. Next is birth weight, which is babies with a birth weight less than 5 pounds 8 ounces. This may cause eating problems, chronic infections, and difficulties gaining weight. Miscarriage is when the fetus dies before 20 weeks of pregnancy. There is a 40% increased rate of miscarriage due to cocaine use during pregnancy. Birth defects. Defects of the brain, face, eyes, heart, and limbs. Some examples of birth defects are intracranial hemorrhage, which is bleeding in the baby's skull due to the constriction of blood flow to the fetus and high blood pressure in the mother. Cardiovascular disorders. Some examples are a small hole in the heart, a leaky valve, and issues with the heart muscle. Limb defects, which are caused by amnion rupture, cleft palate, which is an opening or split in the roof of the mouth that occurs when the tissue does not fuse together during development. Swelling kidneys, caused by urine overfills or backs up into the kidney. Intrauterine growth restriction, which is slow growth in the uterus. Stillbirth, which is when a baby passes away before or during delivery. 24,000 babies are stillborn each year. Cocaine increases the risk of stillbirth by over 2%. Neural development issues, such as delays in sensory motor development, attentional deficits, and delay in language development. Some examples of that are Down syndrome and ADHD. Another possible effect, which is actually very common, is the neonatal abstinence syndrome, which is when a baby is born with a drug dependency and having to suffer through withdrawal upon birth. Some of the symptoms for neonatal abstinence syndrome are crying that is excessive and high pitch, irritability, trouble sleeping, excessive sucking, feeding issues, and slow weight gain, fever, sweating, quick breathing, stuffy nose and or sneezing, trembling, and seizures. Babies born with neonatal abstinence syndrome sometimes have to be hospitalized to undergo treatment for withdrawal. Treatment could go anywhere from a week or longer. There's no definite time frame for that due to it's more based on the severity of the baby's dependency and its response to treatment. However, not all babies exposed to cocaine or other drugs necessarily have to be hospitalized. Medication treatment for neonatal abstinence syndrome is a last resort when a case is severe. So here we have some images that show some of the effects of cocaine on the womb. The very top, we have an increased chance of kidney defects, increased chance of placental abruption, increased chance of low birth weight, increased chance of heart defects and arrhythmias, increased chance of smaller head circumference, increased chance of premature birth. So cocaine, for example, has more of a pterygium effect during the embryonic stage. During the fetal development stage is when the growth abnormalities and neurological issues are developed. And a lot of times, again, babies exposed to cocaine during pregnancy have a tendency to be born dependent on the drug and have to go through withdrawal after birth. In 2020, it was reported that 750,000 unborn children have been exposed to cocaine at some point in the last year. Whether it is long term or short term exposure, cocaine can have severe and dangerous effects on a developing fetus. Some children exposed to cocaine during pregnancy are not affected. Some are born with mild symptoms that have a short term effect, and others are born with effects that can last throughout the child's lifespan. There is no way to guarantee that a fetus will not be affected by cocaine exposure, nor is there an amount that could be used without the possibility of it affecting the developing fetus. Due to cocaine's potential health risks, is why pregnant women should avoid using cocaine during pregnancy. If a woman has a cocaine dependency, she should seek help immediately to try to minimize the exposure of her on her unborn child.